Hi, morning. Let's continue your rationalization of your review module. And today we'll be talking about your integumentary nursing. So let's start. Number one, adequate nutrition is essential for a burnt client. Which of the following statement is correct about the nutrition needs of a burn client? Is it A, client needs 100 calories per kilogram throughout hospitalization? B, the hypermetabolic state after burn injury contributes to poor healing? C, a cool environment decreases caloric demand. D, maintain a hypermetabolic rate decreases the client's risk of infection. So let's try to find the wrong options first and eliminate them so that we can have a clear view of what's the right answer. So in this case, let's first eliminate letter D. Why? Because hypermetabolic will not decrease infection, it would rather increase. So it should be increase. So let's eliminate B. Next, let's also eliminate letter C. Why? Because if you expose your client to a warm or cool environment, regardless of its warm or cool, still the body will try to compensate. So if you put a client to a cold environment, the body will spend energy to warm itself. On the other hand, if you place a client in a warm environment, it will spend energy to cool itself. So either cold or warm environment, you're stimulating the body to use energy. The patient has experienced burn, therefore you need to conserve that energy. Therefore, the patient should be placed on a normal temperature. Patient needs to be placed in a normal temperature environment. So that leaves us to only A or D or B. Answer here is Boston. Hypermetabolic state after burn injury contributes to poor healing because, like I said, if in hypermetabolic state, your energy are being used. So instead of spending that energy to heal the wound, it is used in other parts of the body. So the answer here is Boston. In terms of the nutrition of a client post-burn, in terms of the calorie of patient post-burn, client needs to have 1.5 to 2 times your basal metabolic rate. And when it comes to protein, patient needs 1.5 to 2 gram per kilogram protein. So the answer here is Boston. Next, number 2. Which of the following characteristic is correct for a deep partial thickness burn? Is it A, pain and redness? B, minimal damage to the epidermis? C, necrosis tissue through all layers of skin? Or D, necrotic tissue through most of dermis? So what we're looking here is a part or something that has related to deep partial thickness burn. So first, let's eliminate A and B because this too is an injury or a burn that is considered facial. So it's either C or D. Answer, Dallas. Why? Because letter C is characteristic of deep, I'm sorry, this is characteristic of full thickness. Full thickness. So, eliminate C. The answer is Dallas. Dallas is your deep partial thickness. Next, number 3. Which of the following characteristic is a classic sign of a bite from a brown recluse spider? So in this section, we're talking about the assessment for a bite from a spider. So again, let's try to eliminate wrong options. Let's eliminate A. Why? Because bullseye rash is a characteristic of Lyme's disease. Okay, let's also eliminate B, because letter D is a characteristic of poison ivy. So that leaves us the only two options. The answer here is Boston. Why? Because letter C is a condition that we commonly see on patient who has pityriasis rosea. So that's S. This is S. Okay. This is actually a skin rash. Skin rash. It's not a bite from a spider. Therefore, the answer here is Boston. Next, number 4. Which of the following instructions should be observed when administering Mantoux test? A. Use the diluted muscle. B. Rev the site to help absorption. C. Read the results within 72 hours. Or D. Read the results by checking for a rash. So let's try to eliminate wrong options, which is obviously A, because we do not use the delta. Remember, Mantoux test is your PPD, or your protein, or your purified protein derivative. It is used to check exposure to TB, and the test is usually done intradermally, not IM. So eliminate A. Next, we also need to eliminate B, because we instruct the patient not to touch. Okay, instruct the patient not to touch the site of injection. So eliminate B. So there's only two options left, which which we will choose from. The answer here is letter C. Okay, it will actually take 2 to 3 days before reading is possible. What makes the wrong is the word rash, because there's no rash here. We actually check the level, or the size of the induration. So the answer here is letter C. Next, number 5. A woman is worried she might have lice. Which of the following assessment finding is associated with this infestation? A. Diffuse pruritic wheals. B. Oval white dots stuck to the air shaft. C. Pain, redness, and edema with an embedded stinger. Or D. Pruritic papules, pustules, and linear burrows of the finger and toe webs. So, in this situation, we're talking about assessment for lice, and we need to eliminate some wrong options. Let's try to eliminate letter C. Why? Because of the word stinger. Remember that the patient we're checking the patient for possible lice infestation, not if the patient is stung, for example, like a bee. Okay, that's a stinger. So this is a different situation. Next, let's try to eliminate Dallas. Why? Because letter D, from the word burrows, this is an indication of possible scabies. So that's leave us only two options. One is the possible answer. Answer here is Boston. Why? Because letter A is seen on patient who has allergic reaction. Allergy. Okay. Oval white duct stuck to the hair shaft. We call this your nits. Okay. This is actually the egg. This is actually the egg of your lice. So the answer here is Boston. Next, number 6. A bite from a large dog will cause which of the following types of injury? A. Abrasion. B. Crush injury. C. Fracture. Or D. Puncture wound. So in this situation, we're talking about bite from large dogs. Please take note of those keywords. Large dog. So let's try to eliminate wrong options here, which is one of which will be A. Eliminate abrasion, because abrasion is due to friction. This is due to friction and not from a bite. Okay, so let's try to eliminate letter C also, because fracture, bite from animals seldom or very rare that it will cause fracture. So it's between boy or us. Answer, since the dog is large, the answer here is Boston. Because letter D, this is from small dogs. Small dogs. Therefore, the answer is Boston. Next, number 7. The distribution of lesions on the skin can help determine which of the following factors: A. Disease. B. Type of lesion. C. Color of the lesion, or the arrangement of the lesion. The answer here is letter A. Why? Because the type, the color, arrangement, plus the distribution, all of these factors will try to give you an idea of what specific skin disease is happening to the patient. Therefore, the answer here is letter A. Next, number 8. Client arrives at the office of his physician complaining of several palpable elevated masses. Which of the following terms accurately describe these masses? A. Erosion. B. Macule. C. Papule. D. Vesicle. Let's try to eliminate wrong options, which is vesicle, because we all know that vesicles are fluid filled. Okay, so the situations is indicating a palpable and elevated mass. Let's try to eliminate A2, because erosion is defined as a loss of your epidermis layer. This is a loss of epidermis layer. So that leaves us only two options. The answer here is letter C. Why? Because macules are skin lesions that is considered to be flat and not elevated. C is the answer. Next, number 9. Which of the following adverse reaction may be caused by the use of isotretinoin Accutane? A. Birth defects. B. Nausea and vomiting. C. Vaginal yeast infection. Or D. Gram-negative folliculitis. So we're talking about possible reaction from isotretinoin Accutane. Remember that isotretinoin Accutane is a medication that is used to treat, this is medication for acne. So let's try to find wrong answers first. Let's eliminate D, because letter D is in a patient taking clindamycin. Okay, let's also eliminate letter C, because these are patients, or this infection is common to patients taking tetracyclines. So that leaves us only two options left. The answer here is letter A. So don't forget that, or always remember that isotretinoin is it's a category X for pregnancy. which means it's very high risk that can cause teratogenic effect, even in small amount. The answer here is letter A. Next, number 10. Client complained of small red pruritic dots between his finger and toes. Which of the following condition is the most likely diagnosis? Is it A. Contusion, B. Herpes zoster, C. Scabies, or D. Varicella? Let's try to find wrong options first. So going back to the question, it says here that there is a pruritic dot. Therefore, let's eliminate A because contusion means jarring of the head. So it's C on neuro, and there is no pruritus there. Okay. Next, herpes zoster is characterized by vesicular lesions. When I say vesicular, it should be fluid filled. So it was not mentioned in the option that it is fluid filled. Therefore, it's not herpes zoster, which makes D wrong because varicella is the causative agent of your herpes zoster. So that leaves us to only letter C as the remaining, and therefore it's the correct answer. Next, number 11. Which of the following instructions given to a client taking nystatin or microstatin oral solution? A. Take the drug after meal. B. Take the drug before meal. Mix the drug with small amount of food. Or D. Take the half dose before and half after meal. In talking about microstatin or oral solutions, it's very important that um, when you're going to take this, there should be no other things that touches the mouth because it's very important that this drug can have access in the entire oral cavity for it to have an effect. Therefore, the patient taking microstatin cannot take the drug with meal or before meal because it's very important that the drug should exert its effect first in the oral cavity, and the best way to do that is to take the drug after meal. The answer here is letter A. Next, number 12. The client is examined and found to have pinpoint pink to purple non-blanching macular lesion 1 to 3 millimeter in diameter. Which of the following terms best describe this lesion? Is it A. Ecchymosis, B. Hematoma, C. Petechiae, or D. Purpura? Let's try and locate first the wrong options. We can now eliminate A and we can now eliminate B. Why? Because ecchymosis is bruising, while hematoma is collection. This is a collection of blood. So it's not hematoma. So it's either C or D. Answer, letter C. Why? Because purpura is similar to petechiae except that purpura is said to be greater than 1 centimeter in size. Therefore, the answer here is letter C. Next, number 13. A client has a rash consisting of scattered lesions on various parts of the body. Which of the following type of rash is this? Is it A. Annular, B. Confluent, C. Diffuse, or D. Linear? So again, let's try to eliminate wrong options. Let's eliminate D because linear types of rash arranged to. These are types of rashes arranged in lines. Okay. Next, let's eliminate A because annular rash are rashes that are ring shaped. They try to imitate a ring when it comes to arrangement. So it's either B or C. Answer, Boston. Sorry, letter C. Eliminate B. Why? Because confluent or rash arranged near each other. Near each other. And we all know that in the situation it says scattered. Therefore the answer here is letter C. Next, number 14. Which of the following terms best describe hair loss in small round areas on the scalp? Is it A. Alopecia, B. Amblyopia, C. Exotropia, or D. Seborrhea? The answer here, first let's eliminate B, C. Why? Because these two are eye disorders. They are not hair disorder. So that leaves us to only two options. The answer here is A. Why? Because seborrhea is a form of dermatitis. Therefore, the affected part is the skin. The answer here is letter A. Next, number 15. Which of the following conditions or factors is cause of atopic dermatitis? Is it A. Bacteria, B. Fungus, C. Hereditary, or D. Virus? Answer, letter C. Why? Because atopic dermatitis is inherited from parents to children. Okay, it has a genetic predisposition, therefore the answer is heredity. Next, number 16. A client has rough papules on the soles of his feet that are sometimes painful when he walks. Which of the following term best describe this condition? A. Filiform wart, B. Flat wart, C. Plantar wart, or D. Venereal wart? As you can see, all options are warts. So we just have to find out which type of wart is commonly seen on this underline this keyword soles and considered to be rough papule. So let's eliminate some wrong options. Let's eliminate letter D because venereal warts are type of warts commonly seen in genitals. So it's not B. Let's also eliminate flat because flat warts are considered to be smooth. Therefore, this only leaves us only two options. Answer here is letter C. Plantar warts. These are warts commonly seen in the soles and considered to be rough and papule type of lesion. Answer C. Next, number 17. Client reports circular lesions on his neck. Which of the following condition is the most likely explanation? A. Candidiasis, B. Molluscum contagiosum, C. Tinea corporis, or D. Tinea pedis? So, take note that the patient or the description of the lesion is circular and is found in the neck. So based on this, let's try to eliminate some options. Eliminate D because Tinea pedis is found in feet. Okay, this is what we also call your athlete's foot. Athlete's foot. So it's not Dallas. Let's also eliminate A, candidiasis, because candidiasis is type of infection that infects commonly mucous membranes, like your mouth, vagina, and other mucous membranes. So that leaves us only two options. Answer, letter C. Tinea corporis, or this is what's for your ringworm. Letter B is a viral infection, viral infection of the skin. C is the answer. Next, number 18. Client has thick, discolored nails with splintered hemorrhages, easily separated from the nail bed. There are also ice pits and ridges. Which of the following term best describe this symptom? To be able to answer this question, let's go back to the situation, which indicates that the type of lesion is termed as splinter hemorrhages and easily separated from nail beds. Best answer here is Boston, because this is the mentioned characteristic of the lesion is seen on this type of disorder, psoriasis, and it's not seen on the other options. So we all know that scabies is an infection commonly located between fingers, so it eliminated. Seborrhea, common to newborn. This is also called your cradle cough, so it must be eliminated. Best answer here is Boston. Next, number 19. Client found unconscious at home is brought to the emergency department. Physical examination shows cherry red mucous membrane, nail beds, and skin. Which of the following factor is the most likely cause of this condition? Is it A. Spider bite, B. Aspirin ingestion, C. Hydrocarbon ingestion, or D. Carbon monoxide poisoning? Going back, sorry, going back to the situation, the physical examination was done, and they found out that there is cherry red mucous membrane. This is a classic sign of Dallas. So if you see cherry red mucous membrane, it points out to carbon monoxide poisoning. Answer here is Dallas. Next, number 20. Which of the following terms describe a fungal infection of the scalp? A. Tinea capitis, B. Tinea corporis, C. Tinea cruris, or D. Tinea pedis. Let's try to define each one. Tinea corporis is a fungal infection of the body. Tinea cruris is the fungal infection in inner thigh, while Tinea pedis is the fungal infection in the foot. Therefore, the answer here is A, because capitis is a fungal infection of the scalp. Answer A. Next, number 21. Which of the following stages of acquired syphilis is characterized by the appearance of nodular, pustular, annular lesions? A. Latent, B. Primary, C. Secondary, or D. Tertiary. So let's eliminate options. Eliminate B. Well, because in primary stage, the characteristic in this stage is your painless canker. So eliminate B. Let's eliminate D because in tertiary, characterized by destructive lesions. Destructive lesions because they already involve organs. So it's not Dallas either. So it's between A or C. Answer, letter C. Nodular, pustular lesions, remember, occurs or arises on secondary stage. C is the answer. Next, number 22. Full thickness circumferential burns to the chest cause difficulty breathing. Which of the following surgical intervention is needed to correct this condition? A. Intubation. B. Sclerotomy. C. Needle thoracentesis. Or D. Insertion of a chest tube. So let's go back to the history. It says circumferential burn. If it's a circumferential burn, it means the burn affected the entire circumference. For example, going in this figure, the hand had a circumferential type of burn. It means the burn extends around this part of the body and until here. So it involves the entire, for example, if this is the hand, for example, the burn affected the entire circumference of a certain part of the body. Now, a part of the body that undergo or that is affected by burn shrinks. Like for example, this part of the hand that had burn shrink. Now, if this happened to your chest, the chest will shrink and the patient will complain of DOB. Therefore, the doctor needs to make an incision here so that to release the pressure and to expand again this part of the shrink part of the body secondary to the burn. So, na-shrink yan, kailangan ma-release yung pressure, kaya hinihiwa ng doktor. Ang tawag natin doon, Boston. Sclerotomy. Next. Number 23. Client has just arrived at the emergency department after sustaining major burn injury. Which of the following metabolic alteration is expected during the first 8 hours post-burn? So, is it A, hyponatremia or hypokalemia? B, hyponatremia and hyperkalemia. C, hypernatremia and hypokalemia. Or D, hypernatremia and hyperkalemia. So let's try to eliminate some options. We all know that during burn, patient sodium decreases. So it should not be A. I'm sorry. It should not be C, and it should not be D. It should be hyponatremia. So it's only between A or B. Now there is hyponatremia because of fluid shifting. What happened, on the other hand, when it comes to potassium? Does it increase or does it decrease? Answer, it increases. Therefore, the answer here is Boston. Why? Because during burn, there is cellular destruction. And when cells are destroyed, remember that cells contains a lot of potassium. So if cells are destroyed, this potassium from these destroyed cells goes out and goes to your blood. Therefore, the patient develops hyperkalemia. Next. Number 24. A client has partial thickness burn to both lower extremity and portions of the trunk. Which of the following IV fluid is given first? A. Albumin. B. Dextrose 5% in water. C. Lactated vinegar solution. Or D. Normal saline solution with 2 milliequivalent of potassium per 100 ml. So remember that after burn, the patient is considered to be hyponatremic and acidotic. So you need to give a fluid that will replace sodium and cure acidosis. Answer, letter C. Okay, lactated vinegar solution will replace sodium, and in the liver, LR is converted into bicarbonate. Therefore, it cures acidosis. Answer, letter C. Next. Number 25. Which of the following method is best for making sure client receive an order, dressing change each shift? Write the order in the client's plan. B. Put a sign above the head. C. Tell the nurse about the treatment in the report. Or D. Document the dressing change in the narrative. No. Answer A. Why? Because the issue here is to ensure that the order is done each shift. Now remember that each shift there will be different nurses. And nurses communicate to each other in terms of the care of the patient by the nursing care plan. Therefore, to make sure that it will also be implemented by the next shift nurse, the order or the intervention must be written on that plan. A is the answer. Next, number 26. Which of the following nursing diagnosis is correct for a client with reddened sacrum unrelieved by position change? A. Risk for pressure ulcer. B. Risk for impaired skin integrity. C. Impaired skin integrity related to infrequent turning and positioning. Or D. Impaired skin integrity related to the effects of pressure and shearing force. So the first thing you need to do here is to determine if does the reddened sacrum an actual problem or is it a risk factor that can develop into a potentially actual problem. So remember that it says here, the redness sacrum is unrelieved by position change. Therefore, no matter how you position the client, the red sacrum still exists, which indicates a first degree or the first stage of the development of pressure ulcer or your bed sores. Therefore, this redness sacrum unrelieved by position already indicates an actual impairment in the skin. Therefore, let's eliminate A and B because, like I said, there's already an actual problem. So that leaves us only two options, C or D. The answer, Dallas. Why? Because letter C is a wrong stated nursing diagnosis because of the word infrequent turning. If you write the word infrequent turning on your chart or it is somehow incriminating in nature. It's as if you're telling that one of the members of the health team or one of the nurse did not turn the patient as properly as possible. So this is basically incriminating. So you do not write this kind of words on any document. Therefore, the answer is Dallas. Next. Number 27. Surgical client has just been admitted to the recovery room after colon resection. Nurse checked the dressing for indication of which of the following complication. A. Peritonitis. B. Paralytic ileus. C. Dehiscence. Or D. Hemorrhage. So the patient was already transferred from OR to the recovery room. Recovery room nurse. Therefore, upon accepting client from OR to recovery room nurse or recovery room, the RR nurse should make his or her assessment. There, in this situation, the patient was just newly admitted to the RR. Therefore, the nurse, according to the situation, is making his or her assessment. Therefore, the nurse is looking for possible complications immediately after surgery, which is Dallas, hemorrhage. Because among the four options, only that letter D is the most immediate complication of surgery. D is the answer. Next, number 28. Which of the following technique is incorrect when giving a client bath? A. Close the bed curtain to provide privacy. B. Change the bath water when it becomes tepid. C. Wash the female perineum from pubis toward the anus, or D. Wash a client without gloves to improve the nurse-client relationship. So in this situation, we're looking for something that is incorrect. Answer, Dallas. Why? Because you need to wear gloves to prevent transfer of microorganisms. So letter D increases risk of infection. Okay, therefore the best answer here is Dallas. Next, number 29. Which of the following techniques is correct for obtaining a wound culture from a surgical site? Answer, letter C. Because you need to swab from the center going out. Letter A is wrong because you do not irrigate. This is contraindicated because it washes away the microorganism if you irrigate the wound. B is also wrong because it says you will swab or swipe the crusty secretion around the wound, so you need to get sample from the middle, not from the outside. And letter D is also wrong, so I'll cross out that because different sites, right? It says here several sites, therefore you need to use several swabs. Okay, you do not use a single swab for different sites. The answer is C. Next, number 30. Which of the following characteristic of an abdominal incision would indicate a potential for delayed wound healing? A. Suture dry and intact. B. Wound edges in close approximation. C. Purulent drainage on soiled wound dressing. Or D. Sanguineous drainage in wound collection drainage bag. So we're looking for a manifestation that indicate or that may indicate delayed wound healing. Answer C. Why? Because it says here purulent, it means infected. And if a wound is infected, recovery is longer. C is the answer. So that ends our rationalization for integumentary. I hope you got very high in your exam. And until our next rationalization, thank you and goodbye.